And here we are, scissors and scrubs, on a nice cold spring evening.
Beautiful.
Celtics are in the playoffs. Bruins are in the playoffs. Laura just won tickets to the Celtics playoffs. I'm more of the hockey person. I like watching hockey. Brian and I were talking about that last night. I'm like, I don't get any other sport. I could watch hockey all day long. I said, Laura hates hockey. I could kill her.
I can watch a live hockey game. I can go to a game.
I can watch it
it
on TV. I love hockey.
And I will watch playoff hockey. Regular season hockey, wake me up.
I love hockey. I like watching them skate, and I just love it. I can get through a football game. I yawn through baseball. I'd rather watch grass grow than watch baseball. And Brian likes baseball. I'm a hockey girl. Anyway, so that's where we are in this cold April recording session.
Yes.
But we're recording actually for the month of May, which is ALS Month. So we are going to talk about ALS today, but we're going to always, you know how we like to pair with a fine wine. So we're going to pair it with another horrific disease, Huntington's disease.
Both are just tragic.
I don't know what's worse, being set on fire or drowning in the icy cold ocean.
It's awful.
They're both horrific diseases. So welcome to spring. Here we go. This is what we're going to talk about. So I'm going to kick it off with Huntington's disease. Okay. I'm sure once I get into it, it's just going to come out as Huntington's disease. I got my info from Mayo Clinic, National Institute of Health, and something else. So, Huntington's disease. The reason I am talking about Huntington's disease is I have a very good friend her DNA is not the Huntington side. Her uncle or grandfather, somebody married a woman who had it.
Okay. And
that side of the family brought Huntington's in as an uninvited guest. So I was always interested in it because I was talking to one of the anesthesiologists last night, and he's like, "You still doing the podcast?" I said, "Yes." And he's like, "What are you doing?" And I said, "Oh, we're doing Huntington's and ALS." Oh. He's like, "Oh, what do you think is worse?" And I was like, "I don't know. ALS, at least you keep your mind." And I'm like, "At least? Like, what do you mean at least? You're completely incapacitated, but you're cognitive. ALS, I mean, Huntington's, you can lose your mind with it as well. So I don't, but you're as completely incapacitated as ALS. I don't know. I don't know which is worse.
I don't think there's a better option.
I don't think there's a great option.
No.
Exactly. So Huntington's is an inherited degenerative nerve disease. I am only drinking water tonight, FYI. It's a progressive breakdown of nerve cells in the brain, and it leads to functional, cognitive, and psychiatric disorders. If symptoms start before 20, it is juvenile Huntington's, and it can progress much faster. You'll see symptoms start in their 30s or 40s, and there's absolutely no cure for Huntington's disease. But there are medications to help you with some of the disorders, some of the symptoms. So, you have movement disorders. You can have chorea, which I had never heard of until I started looking this up, and now I know what it is. It is involuntary jerking or writhing movements. Dystonia, where your muscles are rigid or they're contracted. Slow or unusual eye movements. Impaired gait or posture. And you will have difficulty with speech and or swallowing. Usually both. You will have cognitive... I can't talk tonight. What's wrong with me? Cognitive disorders. You will have difficulty maybe I have it.
Maybe.
Difficulty organizing, prioritizing, or focusing on tasks. You will have lack of flexibility or the tendency to get stuck on a thought, behavior, or action. You just keep repeating it. Lack of impulse control that can result in outbursts, acting out acting without thinking, and sexual promiscuity. They tend to get very violent when they have this. Lack of awareness of your own behavior and your own... God, what did I write? I don't even know what that word says. And you have the slowing and the processing of thoughts and finding words. You can also have difficulty in learning new information. The psychiatric disorders, that's, I think, what makes it so difficult. Is you have all these other things that come with it. The most common is depression, and it's not depression because you've just gotten a horrific terminal illness. It's depression because of the injury that's happening to your brain. So they can be very irritable, feelings of sadness or apathy, social withdrawal, insomnia, fatigue, loss of energy, continual thoughts of either death or suicide. They can have OCD, They can have mania, and they can have bipolar disorders. A lot of them will become like anorexic because of the difficulty swallowing, and they're not focusing on food. It's so important to know Huntington's is not contagious. You can only way to get it is if somebody in your family has Huntington's disease. It is completely 100% genetic. You are only at risk if one of your parents has it or had it. If you're a parent who has the gene, there is a 50% chance you will pass it on to every single child you have. So if you have 4 kids, 50% chance each time you have a child, one of them will get it. Once the symptoms begin, the person's functional ability will worsen over time. And from the time of your first symptoms till the time of death can be anywhere from 10 to 30 years.
Oh, God, that's a long time.
It is, but they're diagnosed in like their 20s.
Yeah.
So you could be dead by 40.
Yeah.
If you have juvenile Huntington's, you're dead within 10 years. And those symptoms are showing up in your teens. The later stages of Huntington's, the affected person will need help in all aspects of daily living. You will eventually end up in a nursing home. You are going to be confined to a bed and unable to speak. Some of them can still understand language, and they might have an awareness of who's in the room. Many of them will forget who family members are, and they're just kind of like vegetative at the end. The common cause of death is pneumonia or other infections, injuries from falling, or complications related to swallowing, usually aspiration because they're on feeding tubes and whatever else at the end. So if you or a family member have Huntington's, you might want to consider genetic counseling before you decide to have children. Yeah. So my girlfriend's family, I'm going to just show you how it was passed on through the family. I have changed names to protect the innocent. Okay. It just shows you how prevalent it will become in a family. And I also have a story of another family who they are going through it as well. So it starts, you have Bert and Bertha. Okay. Bert was like he had gone to a prestigious college. He was a lawyer. He was very, very, they were a high class family, you know, and we're talking, this is probably like 40s and 50s. Bert passes away, but nobody knows at the time that it was Huntington's. Oh. So Bert and Bertha have a child, Cindy. Cindy's positive, but again, nobody knows about Huntington's. So Cindy marries Charlie. They have 4 children. Cindy, probably like late 60s, early 70s, people in town thought she was an alcoholic because she was always like, her gait would stagger and she'd have outbursts, and they're like, oh, she's a drunk. Well, in 1973, she's diagnosed with Huntington's. But by then, she's already had 4 children. Yeah. So she has Darlene, Doris, David, and Donnie. 4 kids. Darlene is negative. Now, because Darlene is negative, she cannot pass on the gene. She has 4 children. They are all negative. Doris is positive. Because of that diagnosis, she has 0 children. She was diagnosed probably in her 30s, and she died in 2009. I don't know how old she was when she passed. David is positive. He's diagnosed in his 30s. He's deceased by 2011.
He did not have children.
He does have children. I'll get into them next. Okay. Donnie has 3 children. David has 3 children. Then there's Donnie. He had 4 children. No, he had 3. Donnie and David both have 3 children. Okay, so of the original couple, Cindy and Charlie, she has 4 children. 3 of the 4 are positive. 2 of the positive each had 3 kids. Okay. So Donnie, he is 30 when he is diagnosed, and he is deceased by 2022. I believe he was just shy of 50 when he passed. So David is positive. He has Elizabeth, Ellen, and Eric. Elizabeth won't get tested, so we don't know whether she has it or not. She does not have children. Ellen is negative. Eric is positive. He never has children. He was diagnosed in his 20s, and he passed at the age of 40 in 2022. Donnie has had 4 children. Francine, Faith, and Fiona. Faith is negative. Francine has not been tested. And Fiona has not been tested. They are probably, I know Francine is probably, at this time now, she's 29, 30. She's already had 4 children. She has been showing signs since she was 26, maybe even younger.
Mm-hmm.
And her signs are like, she's promiscuous. She's had children at like 16. She has been extremely violent to significant others,
mm-hmm.
to like arresting and outbursts and really unbelievable behavior.
Mm-hmm.
So she has not been diagnosed, but my friend's pretty sure.
Yeah.
And she's like, she's got it. There's no doubt she's got it. So now she has had 4 children, and these kids are young. They're probably all under the age of 10.
Mm-hmm.
They're too young to be diagnosed yet. One of them is going to have it. You don't have 4 of them all negative. So one of them will have it.
Right.
So that's how
it gets
like
passed.
you mean Bert, they have one daughter, Cindy, positive. Like there was no way she was not going to be positive. I don't know how that happened, because like if they only had one kid, she was negative. That was it. Everybody was going to be fine. But it didn't work that way. So then there's the Price sisters story. So it was kind of sad. I'm going to just give you a quick overview. Huntington's is just such a sad story. So this family, Jim Price, and he's diagnosed with Huntington's, but by the time he's diagnosed with Huntington's, he and his wife have had 4 daughters. One of them are a set of twins, let's see. So in 1977, Jim and Barbara are expecting twins, Kim and Kelly, and they get a call from the doctor who diagnoses Jim's mother with Huntington's disease. The doctor tells Jim that, you might want to get genetic testing. It's highly, prevalent in the family. And they got testing, but it was inconclusive, so they decided to have children. 15 years later, his wife Barbara starts noting changes in Jim, and so did the kids. By then, Kim and Kelly had 2 younger sisters, Tracy and Erin. So he was getting stressed. They were fighting a lot. He seemed different. He was irritable. He was mean. You noticed that he had some shaking movements in his hands, kind of like that they remembered the grandmother having.
Mm-hmm.
He would lash out at them. And when you talk to people who have family members with Huntington's, it completely changes their personality.
Yeah.
So she got him to agree to marriage counseling because she thinks, I don't know why they forget about Huntington's. And the counselor at the marriage counselor looks at the way he's clasping his hands between his legs, and he's doing that to hide the tremors.
Mm-hmm.
And she's like, there's something else wrong here.
Right.
So he goes and gets tested at Johns Hopkins, and it's more accurate genetic testing 15 years later, and he's positive.
Mm-hmm.
So now they know all the girls have to get tested. He was a physical therapist. Both he and his wife are physical therapists. Because of the disease, he has to give up the job. He starts declining. And the sisters all decide that they need to get tested for Huntington's. There's a little picture of Jim here. You can't see in the article with his little grandson. He's adorable. So the 4 sisters get tested, and they're deciding who wants to do it, who doesn't want to do it, and should we get tested? I don't know. So they all just started. Kim, I think, was the first to get tested. And in 2003, she just got out of college. She's pondering law school. She's in a serious relationship. She wanted kids, so she needed to know.
Mm-hmm.
She gets tested, and I believe she is negative. Of the 4 sisters, 1 is positive.
Oh.
Let's see which one. So Tracy's negative, Kim is negative, Erin is positive. So she is one of the twins, I think.
Kelly's
Anyway. Maybe she's one of the young ones. So she is positive. I think she might be the youngest child, actually. So she's like, well, what am I going to do?
Mm-hmm.
And what they have done is dove headfirst into foundations and raising money and awareness for the Huntington's disease. And she's just going to live her best life until she can't do it anymore.
Mm-hmm.
The father is still alive as well. He has survived a very long time with Huntington's. And they leave you a bunch of websites that we could probably post when this comes out, of support groups for Huntington's disease, ways to get genetic testing for Huntington's disease, patient support and advocacy, and just awareness of it. It's a horrible disease.
It's terrible.
It's a horrible disease. And it breaks my heart when I hear of anybody getting these things, because they usually strike when you're young.
Mm-hmm.
And, you've already had kids sometimes before you even think of it. But I think now, as the generations are getting older and you know what it is and you know what's out there, if you know it's in your family, get tested before you start.
But like that family you just said, 4 of the young girls that are young girls now are not getting tested.
But they had the children. Yes. But they may not have kids. Like in my girlfriend's family, many of them have chosen not to have children. If they don't test, they would rather adopt. So one of them is actually raising the kids of the girl who they think is having it. Because she can't take care of herself, let alone the kids. And so she's raising no kids. And I just don't know how I would deal with if one of them is like, you raise them and then.
It's a whole ethical thing. And I mean, everybody has a right to do whatever they want. If I had that, if A, I would have to know, adopt. And B, I could not have children. I don't even know that I would adopt because I'm only going to live for X amount of years and I'm going to be
maybe with the
psychotic and
stuff,
angry and, I don't.
What you find when I was talking to my girlfriend today is that it seems like as it's coming down the generations, they're getting it younger and younger.
Mm-hmm.
And they're dying younger as it's going along down the generation. The initial 4 kids, I think, before they even realized, because like I said, the mother, they didn't really know what it was.
Yeah.
And I think all of them had already had kids before they knew.
Right, which is a different thing. But
right, but then now.
I just feel like now if your family had it.
Yeah. And just the 50-50 chance? Pretty high chance.
Yes, there's a chance you might have a child that was,
I wouldn't want to
it's such an ethical dilemma because it's like what are you going to rob somebody from a life just because they're going to die of this? You're going to die of something, but it's just
that's a horrible way to die, though.
It's
I mean, one of her the cousins passed away this year, and she was very close with him, and we would talk about it, and she's like, they had a birthday party for somebody else, and he tried to come, and she would go see him, and she's like, he could barely speak at the end, and and he's young.
Yeah,
he was
so
like
sad.
my age.
And it's sad that people do think you're a drunk addict, you're crazy, there's none of that. It's a terrible medical disease.
Exactly. So that's going to lead us into an even better one, ALS.
Yeah, ALS. I don't know which is better or worse. They're all awful. I got my information from mayoclinic.org, petefrates.com,
Pete Frates,
brainandlife.org, and newhealthadvisor.org. All right. Amyotrophic lateral sclerosis, or ALS, is a progressive nervous system disease that affects nerve cells in the brain and spinal cord, which causes loss of muscle control. Mm-hmm. So it affects motor neurons. It frequently begins with muscle twitching and weakness of a limb or slurred speech. So like nothing huge, like, my leg won't stop twitching. Eventually it affects the control of the muscles used to move, speak, eat, and breathe. Yeesh. There is no cure. Life expectancy is 3 to 5 years.
Didn't Pete Frates live a long time with
I think he had it about 7 or 8 years. Yeah. Symptoms vary person to person. It depends on which neurons are affected, but normally it starts with muscle weakness that spreads and gets worse over time. It often starts in the hands, feet, or limbs, and then it spreads. It kills nerve cells as it progresses, which makes you just weaker and weaker and weaker. Eventually it affects chewing, swallowing, speaking, eating. There's usually no pain associated with ALS. It doesn't hurt.
It's good.
Right. You're not, but you could be in pain from sitting on your, sitting in the chair all day or laying in bed. It's not like things won't hurt you, but it's ALS itself isn't painful. Signs and symptoms of ALS. You have difficulty walking or doing daily activities. You trip and fall a lot. You have weakness in your legs, feet, or ankles. You have hand weakness. You're clumsy. You drop things. You knock things over. You have slurred speech or trouble swallowing. You can have muscle cramps and twitchings in the arms, shoulders, or tongue, which sounds terrible.
That's awful.
And then you can have bouts of inappropriate laughing, crying, or yawning. Like all of a sudden you just burst out laughing or crying, or you can't stop yawning. And you can have cognitive and behavioral changes. Like I said, ALS attacks the motor neurons motor neurons send signals from your brain and spinal cord to your muscles. So when they are damaged, they don't send messages to the muscles, so they can't function. So then they atrophy because you can't use them. ALS is inherited in 5 to 10% of cases. For the other 90%, the cause is unknown.
I thought it was more like 90% was inherited.
No, it's very few are inherited. 90% unknown causes.
That terrifies me.
Yeah. Like, literally, you could just all of a
That
sudden have ALS,
fucking-
not know anybody with it.
I was like safe and secure here for 5 minutes
No.
thinking like, oh, it's an inherited thing. Oh, no.
No,
great.
no,
Poor
only
thing. It
5 to
just shattered
10%.
my night.
Yep. Risk factors for getting ALS. Obviously, it is hereditary. People with familial ALS, their kids have a 50-50 chance of developing it. So if it is familial ALS, there's a 50-50 chance your kids will get it. But that is only in 5 to 10% of all ALS cases. Age plays a role in it. ALS risk increases with age and is most common between the ages of 40 to mid-60s. That is that's the most diagnosed time. Sex plays a role in it. Men are more likely to develop ALS before the age of 65. But after 70, the sex differential is negated.
Mm-hmm.
It doesn't matter. After 70, it's equal, what men or women. There are some genetic variations that seem to put people more at risk for developing ALS, but they can't seem to like grab onto like, okay, this gene is what mutates. There are environmental factors that may trigger ALS. Smoking, especially for women post-menopause. So if you are post-menopausal women,
so I'm good.
do not. Some evidence suggests exposure to lead or other substances at work or home can be a trigger, but no single agent has been identified. Like, it is so...
Could be this. It could be that.
Yeah.
It could be this. It could be that.
Military service also puts people more at risk. And it could... They have no idea why. They think possibly because of like some sort of chemical exposure that you're exposed to more in the military, traumatic injuries, viral infections, or just like intense exertion. Just
stop running marathons.
Right. Well, no, for the military. Oh. That's in the military people. But like, you know, you're constantly doing intense exertion. So that it might just be a stressor that triggers it. Complications of ALS. You're obviously going to have breathing problems. Over time, ALS will paralyze muscles used to breathe. You may start with like at night, like, you know, everything gets worse at night. And at night, you might be like, I just can't seem to get like a deep breath because my muscles aren't working. So you might start with a BiPAP at night, which is like a CPAP that people wear. And then as it progresses, you will usually end up with a tracheostomy and being on a ventilator because your muscles will not be able to help you breathe. The most common cause of death in ALS is respiratory failure. You have speech problems. It usually starts as like mild slurring of words, but becomes more severe as the disease progresses, and people need to rely on like communication technologies. Like luckily now, like, you know, you have computers that can type, you know, you can type into or you can use your eyes to type into a computer now and it can say what you want to say. You'll obviously have eating problems. ALS patients can develop malnutrition and dehydration from damage to the muscles that control swallowing. They are at a high risk for aspiration pneumonia. A feeding tube is usually needed as the disease progresses because they can no longer chew or swallow or anything. And they are at a higher risk of dementia. They often have problems with memory and decision making and are eventually diagnosed with a form of dementia called frontotemporal dementia. It affects that part of the brain. ALS is very difficult to diagnose early because it mimics other neurological diseases. So they do tests that rule out the other diseases, and that's how they come up with you have ALS. They can do an EMG, which is an electromyogram. They insert needle electrodes into different muscles, like through your skin into different muscles, and the test evaluates the activity of your muscles when they contract and when they're at rest. The abnormalities in the muscles seen in the EMG may rule in or out other diseases or ALS. And it can also help guide like your exercise therapy down the road. So you have this. Mm-hmm. These are the muscles that need help working so they can see what they need to do. They could do nerve conduction studies. They measure your nerve's ability to send impulses to muscles in different areas. This can determine if you have nerve damage or certain nerve or muscle diseases instead of ALS. Mm-hmm. They can do an MRI, which could reveal a spinal cord tumor. You know, if you're having trouble with your legs and they're weak, you might have a spinal cord tumor, or a herniated disc, or another disease process. If you don't, then it could be ALS. They'll do blood and urine tests to eliminate other diseases. They could do spinal taps to eliminate other diseases. Muscle biopsies to check for muscle disease as opposed to ALS. So there's a ton of tests they're going to do to rule out other diseases. Mm-hmm. And that's how you're going to get your diagnosis. There are treatments for ALS. They do not stop the damage or reverse it. There is nothing that will stop symptoms. ALS. Yeah. But they can slow the progression of it. Oh my God. And they can prevent complications and make you more comfortable and help you stay more independent longer. There are 3 FDA-approved drugs for ALS. 3. That's it.
Well, I mean, I
don't
even know what you do.
I'm never going to say these right, I'm sure. The first one's Riluzole. That's an oral medication that can increase the life expectancy by 3 to 6 months.
Why?
That's
For what?
it.
So I can sit in a wheelchair
3
3 months? Like, I'm good.
It can cause dizziness, liver damage, and GI conditions. Then there is Adaravone. This can be either IV or oral, and it reduces the decline in daily function. So
I would take that.
You can just help, you might be able to put your clothes on yourself longer. You might be able to make yourself food longer. It can cause bruising, headaches, and shortness of breath. And then there is Relievrio, which slows the rate of decline, especially with daily tasks. So that's just another thing that just helps slow the progression. It may also help you to live longer, but they're doing more studies on it. But it can cause diarrhea, belly pain, nausea, and upper respiratory infections.
Jeez.
You may also be prescribed meds to provide relief from symptoms like muscle cramps and spasms. You're going to get a muscle relaxer, constipation, fatigue. You get excessive spit and phlegm. You can't swallow it all, so it just builds up.
You're constipated because the muscles aren't working and move your stool through.
Pain, from positional pain or, other things. Depression, sleep problems, and you can have meds for the uncontrolled outbursts of the laughing and crying. There are meds to help control that. There are therapies to be used with ALS, and that's probably the most effective things that help you. There are breathing therapies. Like I said, you can get a BiPAP at night, and then eventually you're going to move to a vent. There's also breathing, exercises you can do just to help you keep control of it longer. Physical therapy, obviously, they're going to have physical therapy that helps with movement, and it helps keep you independent as long as possible. You can have occupational therapy. That helps you remain independent, and it gives you adaptive equipment to use around the house so you can, pick up something with one of, those little grab things. Yeah,
like how to put your shoes on.
Yeah, you can use those things.
Like special spoons and shit to eat with. And
there's speech therapy. Your mouth is not working the same. Your tongue is not working the same. Your jaw is not working the same. So they have speech therapy to help them be able to talk for longer. Nutritional support, making sure what you can eat, you are getting what you need nutritionally, and okay, use this thickener in the water, use this to mush up the food, whatever. I can't. And then obviously you need psychological and social support.
Oh yeah, support groups, all kinds of stuff like that.
So coping with it, it said take time to grieve. You are grieving your life as you knew it.
Yeah.
And your independence. But be hopeful. It doesn't mean that's the end. You can still go on. Even though you have a limited time, you can still live life. You can still do things. Think beyond the physical changes. Think of, there are things that people do, that raise awareness, and
the ice bucket challenge.
Right. Your life is completely changed, but that doesn't mean that you can't do things.
Ice bucket challenge was one of the biggest awareness things I've ever seen.
Join a support group. Support groups help. And make decisions now at your diagnosis about your future care.
Right.
While you still, because you do get dementia, you can get dementia and you can get depressed. So make the decisions now. Famous people that have had ALS, Lou Gehrig. It is also called Lou Gehrig's disease.
Nobody calls it that anymore because I don't think they know who the hell Lou Gehrig was.
Well, I hope so.
But but think about it. Lou Gehrig was around in the 30s.
I know, but I think people know Lou Gehrig.
People don't remember. The younger generation, you think if we sat at the lunch table and said, hey, who's Lou Gehrig, they'd know who the hell you were
I think they'd say, oh, Lou Gehrig's disease.
Well, because they're nurses.
Yeah. I don't
know.
Stephen Hawking's, he had ALS. He got
forever.
He lived for over 40 years with it. And there was an article why could he live 40 years? Most people can't live more than 5.
Right.
He was extremely affluent.
Yeah.
He had everything in the world available to him. Yeah. Every assistive thing available to him. And for whatever, and maybe that was just, I don't know, maybe he had a weird strain of it, or I don't know, but he was also extremely affluent, had every available thing you could possibly have for this, so that helped him live a little longer. Paul Cellucci was the governor of
I
Massachusetts.
forgot about that.
Yeah. And he also had ALS.
I forgot about that.
And then there was, I'm just going to talk about Pete Frates because he is from
Pete.
Massachusetts. And I think a lot of people know him anyways.
Yeah.
But
he was the reason he was the start of the Ice Bucket Challenge,
yes,
wasn't he?
Yeah. So Pete Frates was born in Beverly, Mass. He grew up very athletic, like extremely athletic. Played baseball, football, and hockey. He went to St. John's Prep. I think his father had gone there. He went there to play sports.
He was a prepper.
That's in Danvers. He became the captain of the baseball team there. He went on to Boston College. I think both of his parents went to Boston College. He went to Boston College, where he had like a phenomenal baseball career. Notably hitting a home run out of Fenway Park.
Oh, wow.
During the baseball beanpot tournament as a junior. And as a senior, had a school record of 8 RBIs in a game, which included a grand slam and a 3-run homer.
Wow.
Like, he was an amazing baseball player. He led the team in home runs as a junior and senior, and he led in stolen bases his senior year. Extremely athletic kid, loved baseball. Yeah. He went on to play baseball in the Hawaiian League and the German Baseball League after college. He then became director of baseball operations at Boston College in 2012. And that same year, he was diagnosed with ALS. Oh. He, his family on his website, it's just like heartbreaking, but like, they're like, he never gave up. He was like, nope, we're going to fight this. We're going to push. We're going to put this in front of everybody. People are going to know about it. We're going to raise money. There's got to be a cure someday. So he refused to give up. He began Strikeout ALS, which brought about the Ice Bucket Challenge. Mm-hmm. And I don't know if you remember, I'm sure you can go online now and look up Ice Bucket Challenge, that everybody in the world made videos. They would
George Bush did it.
I challenge, and people would say movie stars, and then all of a sudden a movie star would make you'd challenge people to donate and to do the Ice Bucket Challenge. You would donate to ALS,
right?
Pour ice water over your head. Like my kids did it, and they challenged their teachers, I think, but they donated money. And
we didn't just do the challenge.
No, they had to donate money. But that brought so much awareness to ALS, and it brought so much money in to ALS. Mm-hmm. It was like an unbelievable movement. He did die in 2019 at the age of 34 after a very heroic battle with ALS.
Oh, that was so sad.
I know, that was awful. Yeah. It's so sad to watch, anybody with it. It doesn't, but you see this kid
who was so vibrant,
young athlete, and so vibrant, so physical, and to just watch it eat away at him, and then he was in the chair it was
awful.
It was so sad.
All of these diseases, they're just awful.
Yeah.
There needs to be awareness, so hopefully someday there will be a cure for it.
Mm-hmm.
Our beloved Mike will be running the Harpoon 5 Miler in Boston on May 21st, and it's to support ALS. He's going to put a link in the bio or on our website, whatever. Look for it and donate, because it's a worthy cause. May is ALS month, and everybody's touched by this. You're going to know somebody who has it.
Yeah.
It may not be a direct connection to you, but, somebody be like, oh, my husband had it, or my husband's mother got it. You will know somebody who's had this. So it's a horrible disease. If we could ever wipe it out, it would be amazing. So look for that, the Harpoon 5 Miler, to support for ALS and support Mike in his 5-mile run.
Yeah.
Because God knows I'm not going to run it. That's for sure.
Hope I don't see Mike eating pizza on it.
It's a marathon. You're supposed to run. So keep your stories coming in.
Yeah.
We love hearing them.
Mm-hmm.
We love your emails. Don't forget, last episode we talked to Chuck Jankowski, and he's doing the cruise for the Unstoppable RN. Who knows? Maybe Scissors and Scrubs might show up on that cruise. Who knows? Let's see. I have high hopes. So check it out. If for the new nurses that are all listening right now, you need some help. We all need it.
Yeah, I think that's a great
I think it's a great program. Yeah. And you're going to eventually get CEUs for it. So you got to start now, every 2 years.
Yeah.
Next year will be a year.
And that's really something that can affect your nursing. Sometimes you do CEU thing I'll get a book and get my... Yeah. This can actually affect how you nurse and help you become a better nurse.
Exactly. Instead of just paying $30 to the Westin whatever and getting your CEUs. Alrighty, loves. We'll see you in 2 weeks.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsnscrubs@gmail.com.